Where's the skin bit? Oh God, it's not even touching it, is it?
Where the victim of a dog attack needs urgent treatment.
I'm really sorry, okay, but the problem we've got is more
With Max distressed, the team's focus now is to try and stop the bleeding.
The skin over the top here, that's all dead because it's been separated off, and that's why it's just come away with that bandage. This is just going to cause an infection if it stays there.
In my career, I've seen a lot of horrendous and horrific things. It is an accident and an emergency department, so you are going to see the worst of the worst.
34-year-old construction worker Danny has been injured by a high-powered industrial saw. Danny said he was cutting concrete when the saw's guard flew off and hit him.
Hello, I'm Drew, I'm one of the doctors. Nice to meet you. Can I have a very quick look at your face, sir? We'll give you some strong painkillers.
In my career, I've seen a lot of horrendous and horrific things, but it never shocks me what comes through the casualty doors. It is an accident and an emergency department, so you are going to see the worst of the worst.
All right. What we'll do, we'll put some proper dressings on, get you some painkillers and things, and get you to have a look at.
Dr. Greer needs to assess the full extent of the damage.
Can you feel me touching you there?
Yeah.
Yeah. Can you feel me touching you there?
Yeah.
Feel me touching you there? Thanks, Laurie.
Yeah.
What is it that went into your face?
Also.
Sorry.
Working out how deep it is, all right. I know you're in a lot of pain. We'll get you some strong painkillers as soon as we can.
Danny's wound is dangerously close to a major artery.
If you want to put that back on your face.
Also treating Danny is Sister Cameo.
I'm going to give you some morphine for the pain, okay? It can make you feel a little bit lightheaded and dizzy. But it will, I know. Right, let me just give it a little flush. Is that pain easing at all, Daniel?
Not really.
Let's give it a few minutes.
It's me again, Drew the doctor. Just going to have another peek at your face, all right. You're doing really well. A little bit stingy.
Danny's injury is so severe, he'll need to be urgently assessed by a specialist face and jaw surgeon.
Just going to put this on really loosely, Daniel, just so then it stays in place, okay? And I'm just going to give you some antibiotics. Are you happy if it goes over your eye a little bit? It's just to hold it in place, just whilst I come and see you so you don't have to hold it. I'm sorry. I won't let you leave like this, but for now.
It's all right. Thank you.
Just so then it stops the bleeding, alright?
Yeah.
Just don't get infected. Just going to pop a little bit of tape on, alright? Right, we'll just keep it like that for now, alright? Is that okay? You're welcome.
Don, we've got a young chap who's had a sore to face and has a good go in sort of a couple of facial lacerations. I think we'll probably need to take him to theatre.
Dr. Greer needs to find a facial specialist to urgently treat Danny.
We'll send him an ambulance to I1, is it still? Yeah, that's fine. Yeah. Grand, lovely, we'll get him across. Thanks ever so much for your help. All right, we're going to get you across to Sheffield, because that's where the maxillofacial doctors are based. Okay, so to get the best result and to get this done properly, we're going to get you in an ambulance and transfer you across there. Okay. I think that was your mum on the phone speaking to one of my colleagues, so she's just been given an update as well. All right. Okay, we'll get you sorted.
Danny spent 4 hours being operated on by a team of maxillofacial surgeons. He's now back at work, but will need to return to hospital to be seen by a plastic surgeon. Nurse Haley has been called to the assessment hub, where the victim of a dog attack needs urgent treatment.
Oh. He's got you good there.
75-year-old Janet had the wound dressed at home, so Nurse Haley has to delicately remove the bandages to see how severe the injury is.
It's all right, no. It's going to need...
Not too queasy, are you?
Oh, where's the skin bit? Oh, God, it's not even touching it, is it? Do you have to stretch that back and stitch it?
If it will. I'm not sure if there's a little bit of skin loss there as well.
If the surviving skin can't be saved, Janet could need major reconstructive surgery.
Let's just have a look. Right, so what's happened here is the dog's got hold here and it's dragged the skin down, hasn't it? Right, I think there's probably a bit of skin loss. So I've managed to get that bit round to there, but that's all skin loss. Sadly, nothing shocks me. We get some of the things that walk in, you just think, wow, you know. But no, after 18 years of working here, nothing shocks me.
It's imperative that Nurse Becky saves as much of the damaged skin as possible.
It's like a big flap, isn't it? Deep breaths. Well done.
So that skin's just going to stick itself back?
Yeah, I'm going to put some strips on it.
Right.
Dog bite, so the cleanest bite you can get. So, the dirtiest are cats, and obviously that's because they're feral, aren't they? Then it's human.
Really?
Dogs are cleaner than us.
Right.
Which is a bit worrying, isn't it?
It is a little bit.
I like my wounds. A patient comes in and you can see that they've got a big gaping wound, and you're chatting to them, you're closing it up, and then they go home and it's closed and they're satisfied. Right, sharp scratch, deep breath. Done.
Done it?
Yeah, look after it and I'm sure it'll do well.
Yes,
all right.
I will, and thank you so much.
Oh, you're welcome. And I'll see you Friday morning. Don't forget to hand that slip in as you leave.
I won't.
All right, my lovely.
Janet had to return to hospital the following day. She had a skin graft 2 weeks later, and her treatment is ongoing. Nigel has deep lacerations from a DIY accident with an angle grinder. With no nurses to do an initial assessment, Junior Dr. Tariq Khan is assigned the case.
I'm originally from Pakistan. My grandma had some brain tumor. Looking at her sufferings, it made me even more motivated to become a doctor. Being a doctor in England is kind of like a dream come true. Hello, my name is Tariq. And now here I am in Barnsley. So, what brings you here today?
I got an angle grinder and it snatched, but it pulled it straight out of my hands, it flew it up in here. I ducked back and it landed on my leg. The chainsaw was out of my control.
I'm just gonna have a quick look. Okay, so that is just superficial. Right. So you said it's stinging rather than hurting?
It's not hurting, no.
Okay. Nigel doesn't look in that much pain. Looking at his wound, you would expect him to be screaming at something like that. If the wound gets very deep, you don't feel the pain. Are you in any pain? Do you need any painkillers?
No, it's just stinging, that's all.
Junior Dr. Khan needs to urgently get a second opinion. Nigel's wound is so deep, he may have severed vital nerves. Due to the severity of the wound, Dr. Khan wants a second opinion from Registrar Dr. Dan Buick.
So the wound is around 13 centimeter long and around 3 to 4 centimeter wide. It's not bleeding currently. We're going to stitch it on surgeons because it's quite wide.
I'll come and have a quick glance here. Description, just give it that size.
Yeah.
My name's Dan, I'm one of the other doctors. Now I hear this is a recurring theme, DIY injuries.
DIY injuries, yeah.
Okay.
I've done that finger on an hydraulic cylinder.
Yeah.
That thumb on a saw, table saw.
Yeah.
And I banged my head on my van and got my Harry Potter scars.
Right. Yo, you've done a proper job there, haven't you?
I have, Only protection didn't have on were leggings.
I don't think leggings would have helped you very much unless they were chainmail leggings.
With Nigel's injury, it was quite a gruesome thing. My focus was not on how bad it looks, my focus was to make sure we do the right thing and as quickly as we can.
Tell you what it reminds me of, is when you watch them films on telly and they cut it blubber up on whales and things, you know, it's so like that.
not stitching that up in the emergency department.
No.
You're at high risk of it getting infected. It needs a proper washout, and then we'll need lots of some deep sutures and then some more superficial. Refer you to the orthopaedic team, and they can sort from there. Well done.
Yeah.
Good work.
Good work, yeah.
Thanks for keeping us in business.
Nigel's DIY injury is so severe, he needs to have an X-ray to check that he hasn't chipped or fractured any bones.
Yeah, it seems totally fine. I don't see any bony injury involved at all.
With no fractures, Nigel will have his wound bandaged until he can have surgery to close the 4cm wide laceration tomorrow.
From having a chainsaw in my leg, I feel as though I'm doing pretty well.
Hi Nigel, my name's Brian, I'm one at Nurses and this is Lisa. Just come to dress your wounds when you can go home.
It's fine.
Just keep it nice and steady for me, my love. I'm just going to pop this dressing off. Just get a little bit of a clean, sweetheart. He's only walking, don't worry. Stop being so pappy. He's a cracker, that, mate.
Aye. That don't hurt at all.
Does it not? Have you not got any feeling in it?
Well, I can feel you doing it, but it doesn't hurt.
Did it hurt when you did it?
Oh, I take it back when you're not pappy at all. I'm just going to hold it together a little bit. And pop this on.
That dicky.
This is the sticky. Alright, you hear it? Yeah. It's doing really well not to bleed that.
Didn't bleed much at all.
Did it not? You've been very lucky there, I think.
That feel better?
Yeah. I feel as though that I've had a really lucky escape and I could have been really a lot worse.
So we've just got some antibiotics for you and then you're free to go.
Right, thank you.
I don't think we are going to stop him DIY stuff, but it will be better if he just do it a bit more carefully.
The following morning, Nigel went to theatre where they successfully stitched up his leg. Ambulances on divert are still arriving thick and fast at Barnsley, but so too are walk-in patients. In cubicle 9, Nurse Marie is looking after one of them, 41-year-old Jonathan.
Hi, sweetheart. Can I just check your legs again? Because you're quite shaky, aren't you?
Hands are freezing.
No, you've got 37.5, so it is slightly raised.
Jonathan has a fever, extreme pain in his legs, and his feet are unusually swollen.
I know you're feeling cold, but you're not cold. You've got a temperature. That's what's making you feel like that. But you really try and keep them covered if you
Sorry,
can.
yeah.
No, you're all right, darling.
Jonathan is a recovering addict. His illness has left him with some serious medical problems.
I've got ulcerated legs, so I get infections quite a lot. Then I've woke up this morning, everything hurts like hell. You know, I've had sepsis and things before in the past. I seem to be prone to them. Yeah. I'm what they call a cross addict. It's drink and drugs. So I got alcoholic diabetes. You know, I was drinking that much, but I'd got the ulcers a long time before that.
Dr. Andrew Youssef arrives to examine Jonathan's legs.
Hey, I got up, woke up this morning screaming because my foot had just gone massive. But it hurts up here as well, around here. All right.
So this has been dressed at home?
Oh, yeah, I did, yeah.
You did it?
Yeah.
Right. Let's see if this will gently come up.
Yeah, it should do.
This one's not quite as bad, is it? Can we show this one as well? So I've put this one on because it would actually stuck to his trouser.
Jonathan's ulcers have caused a serious infection in his legs, and treating them will require some complex care.
Sounds as if you're running out of infection due to these leg ulcers.
Yeah. I really do we're getting out as quick as I can, you know, out of the hospital. I know that sounds daft.
Have you got responsibilities at home?
Yeah. I've got responsibilities.
The last thing Jonathan wants is to be admitted. But if Nurse Marie and the team can't get his infection under control, he's at risk of sepsis again. And that could be life-threatening.
Just do it gently, because this bit that's
Yeah, it's really tough. I spent a lot of years on the streets. In 2000, all the heroin that was coming into England was infected with diesel.
All the way around.
Yeah, just to there. Anyone that was using IV drugs at that time got the same problem. People were losing legs and all sorts. If you see any old school addicts, you'll notice they haven't got an arm or they haven't got a leg, and that's why. It's because it was congealing, you know, in people's veins and stuff.
Despite the serious condition of his legs, Jonathan's hoping he can avoid a hospital stay. But Dr. Youssef has some bad news.
You don't have to admit that, they'll just continue with those antibiotics.
Yeah, that's the last thing I need.
Not knew what you wanted, did it? But
No.
I think you knew it was going to have to be.
I know. Do you think they'll let me out in the morning?
I'm not sure, because you do need a good course of antibiotics.
I was in recovery for 13 years, and sadly I relapsed just before lockdown, and I've been clean now and sober 6 months.
Jonathan is admitted to a ward to get his infections under control.
Oh, don't forget your stick.
Oh, my stick, yeah.
He was able to leave after spending 5 nights on strong antibiotics. His treatment is ongoing.
Oh yeah. Who's Beryl?
Hello, Beryl. My name's James. I'm one of the doctors. I've got Katie with me.
Keep spitting it out, darling, all right? Don't swallow it.
Ready, steady, lift. Sit you up a little bit, Beryl, my love. There we go.
There we go. This lady's on a Pixaban.
Okay.
Sudden nosebleed. The sanitary pads you can see in there.
Yeah.
There's 9 of them in the sink, saturated in blood.
Okie doke.
No AF. BP's been fine. No nausea, no lightheadedness. She was a bit clammy. She looked quite pale. But it was just the amount of blood.
Beryl's blood-thinning medication is stopping her blood from clotting. Without intervention, her condition may become life-threatening.
People have died from just bleeding out through a nosebleed. So it's like anything, if you can't stop the bleeding, then you'll come to a point when everything will stop.
And so it's all coming from your nose, is it, Beryl, down into your mouth?
I'm not sure.
And is it both sides of your nose, or?
We've had to undress her and change her. She was saturated in blood, loads of big clots as well.
Right.
Straighten this out, my darling. I know you've got a lot going on.
Dr. Griffiths needs to stop the flow immediately.
What I'm going to do, Beryl, is I'm going to pop 2 like packs into your nose to stop the bleeding.
Yes.
It's quite uncomfortable, but it'll stop all that blood, all right?
Yeah.
So make your eyes water,
Yeah.
but you'll feel a bit better afterwards.
Thank you.
Right, Beryl, this is the first one, so just rest your head back for me. That's fantastic. OK, doing really well. Nice deep breathe. Open your mouth and breathe through your mouth. That's it, keep your mouth open.
It is one of the most painful things we do to patients within the emergency department, unfortunately. It really does make their eyes water. It's one of those necessary evils, I'm afraid, in order to stop the bleeding.
You're doing really well, sweetheart.
For me. Oh, Beryl, you're an absolute superstar, well done.
Beryl's shivering could be a sign her body is about to go into shock. If Beryl loses too much blood, she'll need an urgent transfusion.
Does it feel like it's slowing down at all, Beryl?
Yes, I think it's it.
Yeah? OK, excellent. Well, we'll check all your blood tests. We might need to give you something to reverse the medication that you take to thin your blood.
Yes.
We might need to give something just to counteract that.
The more elderly patients, I just think they're an incredible generation. You know, they're really stoic, they don't want to bother anyone. Poor old Beryl in resus, bless her, really didn't want to make a fuss.
Hi, Switch, it's James Griffiths, the A&E consultant. Is it possible to put me through to the consultant haematologist on call, please?
Right, so...
Thanks very much.
Okay.
Yeah, I think as far as we know, I think just got to rapid right now. So I think she was so brave. Ooh, everything went out.
She was brave. I'd have cried.
Where you going to see it?
How old are you?
91.
91.
I'm going to get my colleagues from ear, nose and throat to come and have a look at you. You'll need to stop in at least overnight.
Yes.
But we'll go from there, all right?
Yes.
Fantastic.
Beryl has already lost 20% of her blood. If she loses any more, she'll need a transfusion.
My name is Elizabeth, one of the doctors from ear, nose and throat department.
Yeah.
Okay. The doctors have put this vaccine, but I'm not happy with the way they are seated. So I'm going to have to push it further in. Okay? It's not going to be comfortable. I'm so sorry. Now I'm going to push it further in, okay? Just bear with me. Hold on. I'm so sorry. It's sitting better now. Sits a lot better now. Around your nose and your mouth. She's laughing. That's a good sign. It is. There. Yeah, just pick it off there. You're stopping with us, I'm afraid. We'll keep an eye on you.
Yeah.
We'll give you some pain relief. You should feel more comfortable afterwards, okay?
Yes, thank
I'm
you.
sorry I did that to you. I had to.
Beryl needed a blood transfusion. 10 days later, she was discharged and is recovering at home. Four-year-old Max is taken straight through to the paediatric emergency department. Nurse Molly will be in charge of his care.
When Max first came in, he was, bless him, covered head to toe in blood, which immediately just sort of put a bit of panic in you because you're worried about how much blood they've lost. He was literally head to toe covered. There's always the risk with a head injury that they might deteriorate. Children in particular tend to go downhill very, very quickly.
Nurse Molly takes a quick handover from the paramedics who brought him in.
What's the screaming straight away? He's got a laceration under his hairline and described the blood as spurting out. It's quite sensitive to touch.
Okay.
Whatever apply dressing or we'll have a little bit.
All right.
Here with Max is Mum Tani.
He's tripped up, went to put his hands out, but he landed his head straight onto the corner of a very, very hard flower pot. Cracked the flower pot and smashed his head. So, yeah, there was a lot of blood and he was very distressed for a long time.
Nurse Molly does an initial assessment.
Oh, good boy. Could this go on your thumb or your toe?
You did it last time, and what did we do?
Would you like your toe or your thumb? Your finger.
With head wounds, you've always got in the back of your mind that this might be more serious than you think. You just need to be looking out for the signs of neurological damage, you know, consistent vomiting with confusion or loss of consciousness, things like that. It's just regular monitoring to make sure you're not missing anything.
Good boy, that's it, keep going.
So Max is 4. He was diagnosed with Kabuki syndrome when he was 1. It's a rare condition that affects 1 in 32,000 births, so it's very rare. He had hypoglycemia, respiratory trauma, suspected sepsis. We've basically lived in hospital since he was born.
So I'm going to get a magic pen that lights up.
A symptom of Max's condition is that he doesn't like to be touched.
So well, can you see these? Look, these have got circles on here. And when I press this button here, it shines a light. Are you ready?
Distraction is key, I think, in children's nursing. It can be quite a scary environment, a new environment, and finding a common ground like play can really help put children at ease, especially when you've got additional needs.
You press it, and you press it and make the light. Whilst you do that, I'm going to move your hair. Oh, man. Wow.
Finding something that you can relate to them to can help distract them so you can get your normal observations and things.
Would you be better in a cubicle or in the waiting room? Like what?
Where is there a clock?
There's a clock in all my rooms.
Max, should we count the clocks on the way out? Yeah. Right, can you see one? I think there's one round here. That's number 2.
The good thing is about clocks, the obsession he's got with clocks, thank goodness really, because there's a clock everywhere you go. And all the doctors and nurses, Max, know, don't they, that when they see you, they always get the clock off the wall, don't they, and they give it to you to play with.
Max needs his wound to be glued, but if the procedure becomes too stressful for him, he'll have to be transferred to Sheffield for surgery.
That's a lovely box. They knew you were coming. They knew you were coming. Yeah. We can't go home until we fix it.
Why?
Huh?
Why?
And how many clocks have you seen in the hospital so far, Max? 3? You have seen 3? You saw 3 clocks.
Max has a rare sensory condition and doesn't like to be touched, which could make his treatment difficult for Nurse Molly.
Although it's a deep laceration, it looks like it will come together quite nicely. So they're happy that we can glue and steri-strip it. But hopefully it will be nice and smooth and he'll be able to go home with Mum shortly afterwards.
He's not very good when he has to have treatment, so you're going to struggle, aren't you, when you have to have this, when you have to have your wound treated, Max?
She's clearly a very loving and caring parent. She's really good at explaining everything at his level. So he's not really been too distressed while she's here. She's just fantastic.
Oh, what's that? Can I hold it? Wow, that's a nice ball.
Hi, Max. Did Mummy and you have a little bit of a chat?
We did. So we said we're not allowed to go home until we've sorted out his cut.
And then I think we might have to find some stickers and a certificate. Oh, that got a look. And I've got one with robots on, I've got one with ambulance on.
You can have a sticker and a certificate.
If you pick him up, I'll grab the toy.
Max, it's all right, darling. It's all right.
Okay, sweetheart.
But as the team tries to prepare Max, it seems the situation is all too much for him.
Well done, Mum. And then head that end. It's always really difficult when a child starts to cry because even though you know you're doing your job, it's still quite distressing for you as well as them. Okay, sweetie. Okay, I've got his legs, guys. It wasn't that we were hurting him. He was starting to cry, but unfortunately before we'd even touched him because he didn't like us being that close to him. Oh, sweetheart. The additional problem is if we can't close them with steri-strips and glue, then a child will have to go under sedation and there's additional risks with putting children to sleep. So therefore we try and minimise those by treating quite quickly and in our department. So Mum, the next option will be, unfortunately, we'll have to see if we'll have to have a chat with the consultant about some sedation, all right? I'm really sorry, okay? But the problem we've got is the more upset it gets, the more it bleeds. I can't close it whilst it's bleeding. You know what they said?
With Max distressed, the team's focus now is to try and stop the bleeding.
It does happen, the more children cry and get upset, the blood pumps quicker around their body and it can cause that clotting to be unclotted. He was so sweet, bless him, but we decided very quickly we then weren't going to do it, but because we'd then opened the wound, it was just pouring and pouring and pouring and pouring. We'll let him, we're gonna leave off for a minute, leave you with some gauze just to mop him up as he goes along, try and calm him down a bit.
He's difficult.
If they hit their point, that's it, you might as well just be talking to a brick wall.
Well, this is it, and you just can't bring him back down.
As Max is still needing treatment, it's now looking likely he'll have to be transferred to Sheffield Children's Hospital for a general anaesthetic.
Just trying to help him, sort of understand that if he could just cooperate, then we could go home. He just won't.
To save him any further distress, Nurse Molly has arranged a transfer to Sheffield, where Max can be sedated before his head wound is stitched.
Look what I found, because I did promise you one. So look, it's got your name. It's definitely really rewarding at the end of the day when you know you've helped a child or you've helped that family, even if it's only something very small, like reassuring a parent that's very anxious. It makes the job worthwhile. That's it. And look, it says I bumped my head today because I thought that was quite accurate.
We're going home, we're going to get a bit of sleep and then, leave early tomorrow morning to go to Sheffield Children's.
Max's head wound was treated under sedation the next day, He's back home now and happily playing with his collection of clocks. Ambulance patients queue, but emergencies are prioritised. 71-year-old Anne is next to be seen. Her dog collided into a leg over a week ago, rupturing a blood vessel. But the wound has got much worse.
Just give me your date of birth, please.
Sister Jo wants consultant Dr. Julian Humphrey to take a look immediately.
What did the dog do to your leg?
She went straight into my leg, bounced off, back into the room. Of course, I'm playing out here. I'd only a little bump like that. And before I knew where I was, it was a great mess.
Can we have a little look at it then? Let me just go and get something to put underneath. I will, yeah.
So just relax your leg, it's all right, because you've got this stuff here all don't stick to it, so it should lift off quite easily.
All of this here is blood clot, a bit like black pudding, all right? And really, it needs to be got rid of, okay? The skin over the top here, that's all dead because it's been separated off, and that's why it's just come away with that bandage. This clot will potentially become infected very quickly if it's left any longer, and that will cause then a septicemia and a systemic infection if it's not treated, which will be potentially pretty serious in someone of her age. What I think we need to try and do is put a little knife along here and just split the skin and then try and milk some of this clot off, okay? That clot starting to smell a bit now is just going to cause an infection if it stays there.
With the risk of infection so high, Dr. Humphrey will need to operate straight away.
There you go. We'll wait for doctor coming back in and...
Right, okay.
Dr. Humphrey wants to remove the clots immediately.
You're not going to chop it off, are you?
No, I am not going to chop it off. I'm going to tidy it up best I can. When a doctor tells you that he's going to take a knife to your leg in this cubicle right now, that's quite intimidating. Right, what I want you to do is I want you to tell me if you feel any pain, all right? You feeling anything? No, I think it's the answer to that. Right, this is the moment of truth. Right.
When I'm so well, just keep taking nice deep breaths on that.
Nearly finished.
Oh. 2 kids.
Yeah.
6 grandchildren, 18 great-grandchildren.
Wow.
Keep breathing on that stuff. We're nearly finished.
Do you remember all the birthdays as well?
No, but
I don't think I've got that many.
Do you want to just dress it now?
You've done absolutely amazing.
She has. She's been a legend.
Definitely.
I'm not going to play with that anymore now.
Let me go for that.
It is a mess.
You've done a good job, ain't
Top man.
Good job.
All of this area here will heal up, but it may need to have a skin graft put on it. Because this is a very bad area for healing in the body, that shin. You just relax. I thought she tolerated that very well. What did you think?
Amazing, didn't she? Gosh, she's so brave.
What about the dressing? Is it all sorted?
Yeah,
It's not bleeding too much. It won't, I don't think it will bleed.
I've just put some trauma dressing on and some gauze and bandaged it.
Since I've done that, does it feel a lot better?
Yes, since you've moved that lot.
Right. Now, that probably needs dressing again, probably in 24, 48 hours. Because... Of course you can go home, yes.
Yes, you.
OK.
After leaving Barnsley Hospital, Anne was referred to plastic surgeons in Sheffield to assess if she needs a skin graft.